A 27-year-old G2P1 woman at 32 weeks gestation comes to the emergency department for vaginal bleeding. Patient says she was in a motor vehicle accident 2 days ago, but did not experience any pain other than some bruises on her arms. She has had 2 other episodes of painless vaginal bleeding over the past few weeks. Physical examination reveals minor ecchymosis on her arms. She reports tenderness over the ecchymoses but is otherwise in no pain. Which of the following best explains this patient's bleeding? Choice A, detachment of placenta. Choice B, blockage of cervical os by placenta. Choice C, blockage of cervical os by blood vessels. Choice D, abnormal placental attachment to myometrium. Or choice E, folate deficiency. I'll wait 5 seconds and answer the question. When you get a question talking about vaginal bleeding, especially in the 3rd trimester, so about weeks 28 through 40, you want to be thinking about abruptio placenta and placenta previa. Now, in this question, you have one of the big warning signs of abruptio placenta, which is the motor vehicle accident. However, I also tell you that this is a painless bleed and that she's had multiple episodes of painless bleeding over the past few weeks. So this is basically me pushing you more towards placenta previa. So that's why choice B, blockage of cervical os by placenta, is the correct answer. Now, I want to, of course, note that if this was real life, you wouldn't just immediately rule out abruptio placenta, because in some instances, abruptio placenta doesn't immediately present with severe pain, and it actually doesn't always present with vaginal bleeding either. It's rare, but it can happen. So in this case, what you would want to do is give a transvaginal ultrasound, because that can help diagnose placenta previa. If you see a normal ultrasound, that doesn't necessarily rule out abruptio placenta, so you would probably want to do some further tests, because you really don't want to let an abruptio placenta patient go. It can be very severe. But like I said, as far as this question goes, because I said it's a painless bleed, and that she's had multiple episodes, you should be suspecting placenta previa a little bit more. And just real quick, for those of you who are just completely confused right now, early on in your prep or whatever, as the answer implies, placenta previa is when the placenta implants near the cervical os or the cervical opening. Leads to painless bleeding in 3rd trimester a lot, but sometimes in more severe cases, it can lead to severe bleeding, and sometimes it can also get in the way of the birth process. So sometimes you use a C-section to basically get around the placenta previa. And as for abruptio placenta, we can just move on to our wrong answer choices here. Choice A, detachment of placenta, is referring to abruptio placenta, which is basically where the placenta detaches. And a big risk factor for abruptio placenta is recent trauma, like for example, a motor vehicle accident, like described in this vignette. Smoking and cocaine use is a risk factor, advanced maternal age, hypertension. There's some other risk factors, but as I mentioned, usually you're going to have very painful bleeding. Now, I just mentioned that vaginal bleeding and pain are not required in abruptio placenta. It's less likely they'll give you a question like this, but just know that it is possible to have abruptio placenta where it forms a retroplacental hematoma, so you don't actually see blood coming out of vagina. And sometimes the pain can be delayed. And as far as this question goes, even though the motor vehicle accident is separated 2 days ago, that actually does not rule out abruptio placenta. Sometimes it could happen a few days later. And as I mentioned, ultrasound cannot rule out abruptio placenta. But you can look for other signs, maybe like bleeding signs. For example, they could have tachycardia and hypotension. Maybe they have a low hemoglobin. Again, unlikely they'll give you a question that's that complicated, but I just wanted to be complete here. Choice C, blockage of cervical os by blood vessels. This is describing vasa previa. So as described, it is from basically the umbilical cord having exposed veins and blood vessels, and they can also block the cervical os. And while yes, it can also cause painless vaginal bleeding, it usually is accompanied alongside rupture of membranes rather than something that occurs during the 3rd trimester. And also because the blood is coming out of the umbilical cord, essentially, it can also affect the health of the child. So you might have fetal bradycardia or just some other sign indicating fetal distress. Choice D, abnormal placental attachment to myometrium. This is describing placenta accreta, which is actually a spectrum of conditions. It can be accreta, which is adhering basically to the surface of the myometrium, increta, where the placenta penetrates into the myometrium, or percreta, where the placenta can actually pierce through the myometrium and it can actually even invade other organs sometimes. Usually the complication caused by placenta accreta happen after birth, because a failure of detachment of the placenta can lead to severe postpartum hemorrhage. And that's the biggest, most notable risk, really. Postpartum hemorrhage really has nothing to do with 3rd trimester bleeding. Choice C, folate deficiency. This is just a distractor. Folate deficiency, of course, can lead to various neural tube defects if you don't have enough of it during early development of the fetus. So you can get stuff like spina bifida. It's why a lot of mothers are supplemented with folic acid early on in pregnancy. So bring it back. You really want to know the differences between abruptio placenta and placenta previa. Third trimester bleeding, painful is usually abruptio placenta, painless is placenta previa. And they also like you to know various risk factors and associations with both these conditions. For abruptio placenta, it would be trauma, like motor vehicle accidents, smoking, cocaine use, hypertension. Whereas with placenta previa, basically the risk factors are just that you've had placenta previa in the past, or you've had multiple pregnancies, or you've had previous C-sections. Hope you found this video helpful. I'll see you in the next one.